You wanted to know about the status of our isolation centers and what bed capacity we have. I think I will pass that over to Dr. Kuria, who might have the numbers and statistics to respond to that. Your second question was Eastleigh, that we have now lifted. 2 days now, isn't it, since we lifted the restricted movement in Eastleigh. What would happen if there is a resurgence? Well, resurgence is not something that we cannot imagine. It is likely to happen depending on whether those measures that have been put in place are really adhered to or not. If those measures are not adhered to, we expect, yes, that there will be an increase in number of infections and so on. We will place measures to contain that, just as we had done it before. So we will be able to watch out, clearly monitor what is happening in some of these places. And if we feel that there is a trigger point there that things may not be very good, then I think the appropriate measures will be put in place. Chemtai Goin, yours was on two questions. One was on WHO and the statement now that asymptomatic patients may not be high risk in terms of transmission of the virus. And how do we then respond to this new information? What I can say is that, with COVID-19, there are very many unknowns, and there is still a steep learning curve on how this virus behaves, how it behaves in different settings, and what that means for us. This information that has now come out from WHO, I'm sure is an observation from many different places, perhaps, but the evidence is still to be gathered. Sufficient evidence is still to be gathered to be very clear about what an asymptomatic status means. What does it mean? We know we can pick a virus in an asymptomatic. We don't know what the time frame of shedding and the loads of shedding are. Some of this information might be pointing to a fact that it may not be as serious shedding as in other cases that are clinically manifested. But as evidence is gathered, and we feel that that evidence is strong enough, scientific evidence is strong enough for us, then our measures and policies will also be shaped by that information as it develops. Clearly, if we are having a large number of asymptomatics here, then it would make sense that we need to change tact. If the evidence is in place, we need to change tact in the way we deal with that. So asymptomatic, if they turn out to be of low risk, then we can be able to remove them from where we are now keeping them, which is in health facilities, and think of alternatives that will then free up those facilities for those who need those clinical management facilities. Your second question was with respect to the wearing of masks by the elderly, those above 60, and also those who may have underlying conditions. I did talk about this yesterday, and I just want to make some clarifications on that. As you know, the N95 mask is the most efficient one in terms of filtering particles, 95% of the particles. And it is also reserved for specific situations because of its efficiency as a barrier for many particles, viruses included, the small ones too, and also because of its cost and also its use. The N95 mask, because it is so efficient, is also not easy to wear. Anyone who has worn an N95 mask will tell you it is very difficult to breathe in an N95 mask. Therefore, it is really reserved for situations where there is a risk of breathing in the virus from the environment you are, and this applies to healthcare workers who are dealing directly with COVID-19 patients, either in a clinical setting or in settings where they are very close, either sampling them or handling them in one manner or the other. And that really is where it should be best used, so that it prevents that healthy healthcare worker from contracting a virus from the patient. Yes, you could say it could also be used by that patient shedding, but really if one person who is a healthcare has it, I think that is good enough. The one who is shedding may have a great difficulty actually using that mask. In terms of the elderly, we have said the best advice to the elderly is stay at home. Stay at home. That's the safest place to be. Stay at home. If you do have to go out, then wear these surgical, or they're also called medical masks, 3-ply, just like other people as you go out for a short walk or a short trip outside. These are good enough to be able to protect you. However, it's also a matter of choice. There may be those who feel concerned that they may really want to protect them, and that is a matter of choice really, and it's upon the person if they want to use an N95. There will be some inconveniences in use of an N95, as I have mentioned, because it's not a mask you can keep on for a long time. It also restricts the level of breathing that you can get.